Hello and welcome to New Start at Home. We're glad that you're with us today, and we're also glad that Dr. Doug Plata is with us. Welcome, Doctor.
Thank you. Appreciate it.
You're an urgent care physician, also do occupational medicine. In other words, a lot of people see you right when they really are having an issue that maybe is painful, something they can't deal with at home. And you're a family practice physician and preventive med as well. And we're talking in this little series about foreign bodies in the eye. And we talked already about dust and like wood chips or different things like that. You shared a technique about how taking that eyelid over the top of the other one, and then of course the idea of flushing the eye out. But we want to talk this time about what if people get like a metal speck, something in their eye like that.
You know, maybe they're out in the shop and they're grinding on something and something gets into the eye. And again, the most important thing to do is try to irrigate it out. I think the key thing with metals, because they can actually potentially develop, actually sort of spread on the surface of the eye and develop what's called a rust ring. And that would require to actually, removal. It's something that probably an ophthalmologist might want to do. So it's sort of a different category, and the key there is do go ahead and try to get to a doctor right away so that it doesn't cause this rust ring.
Does the rust start to develop just almost immediately, or?
It very shortly. I've noticed that I can even go ahead and take out the metal foreign body, even if it's 3 or 4 hours, and I see that sometimes little portions of it will still remain behind, and that's at risk of developing this.
So can they just call the ophthalmologist if they have one, but what if they don't? Do they need a referral from someone like you?
Yeah, sometimes. It all depends on insurance plans, of course. But I would say probably it's best to go to an urgent care to be able to be seen, right away, or if you can get into your primary care physician, family physician, to be able to have it seen immediately. They can deal with it as well.
So number one, you try and flush it out with water.
Mm-hmm.
Number two, you try and get that foreign body out yourself if you can.
Right.
And then number three, you head to your office or someone that has a slit lamp that can really look closely.
Yeah.
And then you go from there.
Yeah.
Well, let's talk about another thing that sometimes happens to the eyes, and that's a person that maybe is helping another person weld, or,
Mm-hmm.
when I was in the ER a lot, we saw that a lot. What do you do with that?
Now, are you talking about the flash burns, or are you talking about things?
Yeah, the flash burns.
Okay, yeah, it's fairly limited. Not too many people are dealing with this, but it can basically cause an inflammation. The bright light can cause an inflammation of the eye, the iris, and that's something that's going to need more intensive treatment. Oftentimes, medicines and an ophthalmologist would work on that.
And is that something where they have to get in right away?
I would say the sooner the better, basically. Mm-hmm. Yeah. We probably also want to mention about acid and basic substances that get in the eye.
Yeah, let's talk about that. So like you got a chemical, or maybe you're washing and you see that it's a cleaning fluid gets in your eye.
Like Clorox would be a particularly common but worrisome one. And this is something that, again, as with many things that get in the eye, the key is to go ahead and irrigate the eye. And especially if it's some sort of chemical substance like that, you really need to irrigate for a long period of time. 15, 30 minutes would be good. And then, of course, immediately go ahead and have it seen, even if you've really irrigated it well.
So let's say it's my 1-year-old and he's like screaming bloody murder. Do I just, and I feel so bad because he's crying.
Right.
Do I just keep irrigating regardless of him screaming?
By all means.
Just keep going.
It's tough, but you got to do it. I mean, if you have to hold him down, force open the eye, pouring it in, do what it takes. But don't. I mean, the kid's vision. I mean, vision is one of the most important things that we've been given. We want to do what we can to protect it.
So, like, if the parent, the mom, the dad are saying, "No, please don't do that," you say, "Wait a minute." You reason with them, but you just keep getting the fluid there. And you told me something else. You said that the eye is one of the most vascular areas, and
it's one of the fastest healing. It's like 3 layers, and in about 3 days, abrasions, scratches on the surface of the eye, they clear up, and it's pretty remarkable.
That's resilient, as they
Yes.
say. We've been talking with Dr. Doug Plata, and we've been talking about foreign bodies in the eye. Some very useful information, very practical. We hope that you enjoy this kind of information here on newstartclub.com. There's many different topics that you can access, and tell your friends about us. and tell them about the practical information you're receiving here. Thanks for being with us, Doctor.
My pleasure.
And thank you for being with us as well at New Start at Home.